What should you do if you just injured your back and you acutely have lower back pain? What should you do in terms of pharmacological and non-pharmacological approaches? Well, that's the question that this research article was attempting to answer. When you have just injured your back, you get a lot of recommendations from a lot of different people. And those recommendations might be you have to go get a massage, you got to go get adjusted, you got to go get an x-ray, you should go get an MRI, you should do X, Y, Z, and like there's so many things that get thrown at you. But it's hard to decipher like, well, what is the evidence-based approach to approaching this acute lower back pain to resolve it and have the best outcome possible. Now, with lower back pain, we always have to consider the red flags to ensure that something more serious is not happening. And those red flags include, but are not limited to, if you're taking any sort of blood thinner, if you're having a fever associated with your lower back pain, if you've had a loss of bowel and bladder control or a loss of feeling in the genital region, if you are immunocompromised, if you've been taking any sort of IV therapy, or if you have a history of cancer. Simultaneously, if you have a loss of sensation in your limbs that's progressively getting worse, or a loss of strength, like you realize you can't pick up your foot or anything like that anymore, make sure that you talk to your provider and take the steps to ensure that they're aware of those red flags. Now, what this article found is essentially that there were no non-pharmacological treatments, so in other words, none, that were recommended as being extremely effective at treating acute lower back pain. Kind of tough pill to swallow, but we'll talk about that a little bit more. But then there was only one singular pharmacological recommendation that they would have, which was NSAIDs, so non-steroidal anti-inflammatories, right? That were moderately effective for treating acute lower back pain. So based on this article, if you're acutely in pain, the only evidence-based approach that they have to reducing that pain is going to be the NSAIDs. But it doesn't mean it's the only thing you should be doing, because the acute pain needs to be something we need to focus on to try to alleviate it. But we also need to take into account that pain is just going to be part of the experience of the injury that you're having. And we need to not only think about temporarily what we need to be doing right now for the benefit of right now, but what kind of action should we be taking right now to ensure that we get the best outcome once this pain starts to reside a little bit. And that's where there's a separate review that came out that said the only recommendation they could give for treatment for acute lower back pain was to stay active, right? So there's no specific, like you have to go do this core exercise or this glute exercise, but what can we do to stay active, to try to, keep the body as healthy and as strong as we can while the back pain is happening. So that way, as the pain settles down, we are not as deconditioned, not as weak, and still have some mobility. Now, that staying active is going to look different for every single person, because every single case of lower back pain is going to present differently in terms of the things that aggravate it, the things that feel good, your availability and comfort with certain exercises, those kinds of things. So the actual exercises need to be respective of the individual's context, but what we need to put some weight on and kind of give our minds a little peace with knowing is that essentially it's not some magic fix exercise I have to do. I don't have to fix my posture. I don't have to go get adjusted and get realigned again. I really just need to make sure I stay active as this pain resolves, and then reassess, well, what do I need to do to reduce the risk of this lower back pain coming back in the future? And really what we know is to reduce the risk of the onset in the future, there's all sorts of research done on different body parts and trying to understand and predict when somebody gets acute pain, what factors in those people predict whether or not they will have longer term or chronic pain. And out of all the variables they could talk about, they had their biomechanical variables, so such as posture, strength, range of motion, all those kinds of things, lifting technique, and all sorts of psychosocial variables as well. And really what they found is the only variables that correlate or can predict a higher likelihood of somebody having chronic pain, and quite strongly I might add, is going to be psychosocial variables. So fear, avoidance, belief, behaviors. So things like avoiding activity because there's pain, or not thinking you can get through your day because you experience pain, or thinking every time I have pain, there must be something really bad happening in my body. And so for a lot of our clients, what we try to do is we try to coach them up on, okay, what can we actually do to mitigate pain acutely, but then understanding that pain might just be part of the experience to begin with. And if we want to ensure that we reduce the risk of this happening in the future, we have to create a relationship with pain where we understand that we can't avoid everything that has an association with pain, and we have to slowly build into those things while respecting the healing process and the injury that may have happened, and simultaneously just making sure we stay active. And then as things settle down, of how do we apply certain principles to reduce the risk of this happening in the future once again.